Not having money to restore your teeth is a common situation. Because of this, many people are even afraid to go to the dentist. It seems like they're going to start offering expensive treatments that you simply can't afford. That's why people put it off, endure the pain, and only come in when things have gotten much worse. But here's what's important. You don't have to fix all your teeth at once or spend a lot of money. The problem is, hardly anyone explains this properly. Even with a limited budget, it's possible to create a clear, step-by-step plan and avoid losing more teeth. In this video, we'll discuss where to start and what to do if you don't have much money. The first thing you need to do is decide and understand exactly what you want to achieve, what problem you want to solve, or what goal you want to set for your dentist. Maybe it's your molars. You have nothing to chew with, or you're missing your front teeth and feel self-conscious when you smile because it doesn't look good. Or perhaps you're only concerned about one specific tooth. So clearly identify your problem. By the way, you can write down all your questions and concerns on a piece of paper before your appointment. And of course, you absolutely must go to the dentist. The dentist will create a treatment plan or a comprehensive rehabilitation plan for you, where they will certainly take your wishes into account, but will also outline everything that needs to be done. And that's exactly why treatment plans not only seem expensive, but actually are very costly. Moreover, most of the time, dentists, of course, prescribe treatment for both the upper and lower jaws in full, and the total amount turns out to be quite substantial. The main issue, or the real crux of the matter, is that unfortunately, not all dentists explain how you can actually go about implementing this treatment or rehabilitation plan. So how can you actually get your teeth back? That's why if your dentist hasn't explained this to you, here's where you need to start. The first step is to remove the infected teeth. These are teeth that, unfortunately, can no longer be restored, but are a significant source of infection in your mouth. So we remove these teeth. This could be one tooth or several, and these extractions can also be spread out over several visits. It could be one extraction per month. That's perfectly fine too. But the most important thing is to start taking action. In our clinic, and I think in other clinics as well, there are patients who come for several years, gradually setting aside money, but in the end, after a year or two, we restore all their teeth. At the same time, we don't resort to loans or any massive, let's say, infusion from the family budget or the involvement of other funds. The second stage is that we begin treating the teeth, but again, not all the treatment and not all the teeth at once. We make sure to clarify with the dentist which teeth are the priority right now. What is the best place to start right now in order to have time to preserve and save the tooth? Most often, the dentist will definitely show you which teeth should be treated first, and you can calmly treat, say, one tooth per month, allocating a small amount of money. And over a certain period of time, you will calmly have all your teeth treated. As the next step, we have extracted the teeth and treated all the teeth in stages over the course of a year or perhaps even two. Now we move on to prosthetics. And of course, the simplest and most reliable working tools are removable dentures. Of course, we are usually talking about a significant loss of teeth, and together we make a partial removable denture for you, which you put on, wear, and which is inexpensive. But in this way, we have extracted the teeth, treated the teeth, and also provided prosthetics by replacing the missing teeth with such a removable denture. And such a treatment plan or such a restoration is absolutely normal. And most importantly, we are saving your teeth, preserving the bone, we start chewing, and we regain our chewing function. And now with these teeth or with this restored dental arch, we can continue living and perhaps plan maybe next year or in a few years for implantation or other types of prosthetics and treatments, which of course will be more convenient than a removable denture. But the main message or the main goal of this video is so that you don't get scared by large treatment plans. All of this can be broken down into stages, and everything can be made as convenient for you as possible. But most importantly, start moving toward your beautiful smile. Start making your dream of beautiful teeth a reality, and I am sure you will succeed. Another way you can save money, just so you have this in mind and are aware of it. Any prosthetics, any treatment, thankfully, here in Russia, we can receive it with a standard compulsory medical insurance policy. So don't ignore this. Take advantage of it. Yes, it may often involve waiting in lines or making appointments, but this opportunity exists and you just need to be patient. Even removable dentures can be made completely free of charge right at the clinic where you are registered. And the same goes for dental treatment, so make use of this. And you can also, after receiving a treatment plan from a private dental clinic, have part of the work done for free under the compulsory medical insurance (OMS) policy. We have patients who come to us and say, I need to restore my front teeth, I want to be able to smile, but very often when the front teeth are missing, we also don't have any chewing teeth left. Therefore, first of all, if you want to restore your front teeth, let's say the aesthetic teeth, the front teeth, or the teeth in the smile zone, the ones that are visible, you need to restore the teeth that are not visible. These are precisely the chewing teeth, the ones responsible for chewing function. That is, if we restore the front teeth but don't restore the chewing teeth, then literally after a short period of time, we will either wear down the restored front teeth or simply break them. That's why, of course, you need to start with the chewing teeth. And here's a little life hack for you. If you've already started restoring your chewing function, make sure to restore the teeth on one side first. That is, the chewing teeth on the upper jaw and the chewing teeth on the lower jaw. As a result, we already have something to chew with, and we can comfortably chew on one side. Then, after some time, once you've found the means, do the same thing on the other side, and again, only the chewing teeth. And now, finally, we have a full chewing load on both sides. And only then can and should you restore the chewing teeth. And that's exactly when everything will be absolutely correct, and all your restored teeth will serve you for a very, very long time. Take care of your teeth. Treat cavities in a timely manner. Stay healthy and take care of yourself.